Dogs get cancer at roughly the same rate as humans. But how do you recognize bile duct cancer in dogs when it is not seen with the naked eye? Cancer is fatal not only to us but also to our canine companions. In fact, it is the leading cause of death in dogs. It is estimated that 1 in 4 dogs will develop cancer at some point. Out of their entire population, almost 50% of them will develop the disease over the age of 10. While millions of dogs develop tumors yearly, pets today have a better chance of being treated successfully than before. Thanks to medical studies of canine cancer, research gives hope in saving our furry friends' lives. Also known as Carcinoma, it is a type of cancer that involves tumors originating from the bile ducts. Bile is a fluid produced in the liver, stored in the gallbladder, and used within the small intestine for digestion. This digestive fluid moves through the body through small tubes called bile ducts. This means that the disease forms in those thin tubes that connect the liver to the gallbladder and the small intestine. Bile duct carcinoma in dogs happens when unusual cells grow out of control inside the bile ducts. When cancer starts to grow, it prevents the bile from passing. This causes a buildup of the digestive fluid in the liver and hinders the digestion process. All dogs are at risk of developing this type of cancer but not commonly seen in any specific breeds. However, it seems to target female and elderly dogs more than the younger ones. Though it is difficult to predict how a tumor behaves, carcinoma in dogs is a malignant form of cancer. It is aggressive, with the risk of metastases up to 88%. Bile duct cancer can spread rapidly and widely to the abdominal lining, bladder, diaphragm, intestines, kidneys, and lymph nodes close to the liver, lungs, pancreas, and spleen. It can be difficult to treat effectively even if diagnosed before spreading due to its location. In dogs, the mass is more likely to be found in the left lobe of the liver, which is difficult to completely remove by surgical means. Animals with the disease usually have a guarded condition to poor prognosis. Thus, bile duct carcinoma in dogs is a serious concern. Carcinoma in dogs frequently produces the main symptom of a swollen abdomen, which can be due to enlarged liver or fluid in the abdomen. See a vet for proper diagnosis and course of treatment once you see symptoms that your dog might be suffering from bile duct cancer. You may discuss additional testing to determine and plan the treatments that fit your pup's needs. Talk about how large the cancer is and whether it has spread to other organs. Regarding the treatment details, you may raise your concern about which options are recommended. You can also ask how soon you can start the treatment and the potential side effects. At the start of the visit, the veterinarian will perform a thorough physical examination of your pet, checking the buildup of fluid in the belly. Aside from the fluid accumulation, he will take into account the health history and possible incidents that might have led to this condition. Provide the onset of the symptoms to aid the doctor in diagnosis. Be sure to report any exposure to toxins if your dog had encountered such. Following the initial exam, the vet will order a chemical blood profile to measure albumin, bilirubin, cholesterol level, and liver enzymes. He will also conduct a complete blood count, urinalysis, and an electrolyte panel. In addition, a test for fetaprotein concentration will help to confirm whether the condition is due to cancer. To test whether the blood is clotting properly, a coagulation profile will be ordered. 2. Bile duct carcinoma in dogs happens when cells in the bile ducts develop changes causing them to multiply out of control. These cells form a mass or tumor that can invade and destroy body tissues. While there is no preventive care, treatments give hope in saving our canine companions' lives. Chemotherapy has proven to be effective to slow the spread of cancer and decrease your fluffball's discomfort. If the tumor is detected early, it may be removed surgically. If the tumor is too large for removal, other approaches may be done such as radiation therapy or ablation to treat the spread of cancer. The key to managing cancer is early detection. Catching it early is critical for successful treatment, recovery, and quality of life, making visits to the vet important for annual or semi-annual wellness. However, carcinoma is often diagnosed when it's advanced, making successful treatment difficult to achieve. Bile duct cancer in dogs is difficult to treat, as chemotherapy is only a palliative tool rather than a curative. The success of the treatment will depend on how far along it is when your dog is diagnosed. The bile duct is deep inside the body, so unlike the other cancers that are easy to see with the naked eye, signs will not be known in the early stages. Chemotherapy and surgical removal remain the primary therapeutic options, but even with successful surgery, the prognosis remains poor due to the rate of metastases and no treatment found to cure cancer. Your dog will be monitored in an intensive care unit after the procedure to administer medication. Fluids and antibiotics will help control pain and prevent infection. At home, you will need to regularly clean and monitor the surgical wound to ensure proper healing. Your doctor may require antibiotics and pain medications, since your pup's body is weak from fighting the disease and especially after the surgery. You can also do homemade dog food that is easy to digest. Make a special diet that will meet your dog's nutritional needs. When it comes to recovery after chemotherapy, your dog may have a reduced appetite, vomiting, or diarrhea that may last a few days. Thank you for watching this video till the end. Keep watching and stay with us subscribing to this channel. Have a great day.